Hello everyone and welcome back to the Awesome Physio YouTube channel. Today's video we're going to be going through our top exercises to help pregnant women with lower back pain. We're going to be looking at our top stretching and mobility exercises as well as our top strengthening exercises to help regain some of that stability and support the lower back during pregnancy. To start off, I always think the best place to start is with the cat-cow movement. So I will be demonstrating later certain movements with a pillow underneath just to demonstrate the bump so you get an idea of range, but you'll find obviously where I'm doing cat-cow now, with the bump in a way, we're going to be slightly limited going into extension and flexion, but it's a great way to get that lower back moving. So we want to aim between 30 seconds to a minute, getting the back moving. We're then going to very, very gently go into a child's pose position. So this is a great way to decompress and open up through the joints of the lower back. And then I'm going to pop a couple of pillows here. So you'll see with a normal child's pose, we would go a lot back, back a lot further. But you can see here with the pillows, obviously mimicking the bump, it's slightly more of a challenge. So go as far as you feel like you can go, aiming between 15 to 30 seconds. And we then want to move into a side-to-side stretch. So one of the biggest things as we're going into the third trimester is obviously lower back pain, but we can get a lot of tightness into the ribs as well. So by moving side to side, this is a great way to stretch open through the ribs, move the lower back and relax around the body. So really, really fundamental. Next, we want to look at activation through the core and also a pelvic tilt. So what you want to do is as you're lifting up, similar to a cat-cow, you want to imagine that you're tucking your bum under, so you're tipping the pelvis under. This helps take the pressure off the lower back. We want to aim to hold for 5 seconds and then relax, and we're looking at between 10 to 15 reps of this movement. We can make it more of a challenge, and so the reason why I'm adding core activation in is that it's really common with women if there's instability to have pain in the lower back, so we want to try and strengthen as much as we can. So you're still bracing the core tight here, but you're moving the arm above the head to add in that extra instability so that you stabilize through the core, because if you bring the arm up you lose that center of gravity, so the body has to act harder or work harder to strengthen through the core. So we want to alternate between both sides, aiming between 15 to 20 reps and then relaxing. Once we've activated through the core, I want to show rotation through the spine. So I've purposely put a cushion in here to show you when you've got a bump, it's going to massively impact that rotation. So you see, compared to our other videos that we've looked at spinal rotation, this is very limited, so don't worry if you're not going very far. Same with the stretch. So again, you can see, try to mimic a third trimester bump. So as we're getting near the end of pregnancy, you want to gently hold one side and then gently stretch over to the opposite side. So this is absolutely fantastic for opening up through the ribs, absolutely fantastic for moving through the spine and just getting as much movement as you can through the body and stretching areas that become really tight. Finally, we want to look at activating through the pelvic floor, and this is really important. So as we breathe in and then breathe out, as we're breathing out, we're pulling, imagine pulling up towards the belly button. So you're lifting up through that pelvic floor and then holding for 5 seconds. So you want to feel it as if you're pulling up. So imagine you're pulling up toward your belly button as we breathe out, holding for 5 seconds and then relaxing. We want to aim between 2 to 5 rounds of this to strengthen through the pelvic floor, which will massively help improve stability but also support for the lower back.